Maybe you saw it on social media, or it was passed on from a friend or loved one. Maybe you got it in an email, or silently worried about it yourself. COVID-19 vaccine claims are many, but the actual problems are few to none at all. The reality is, the longer we let lies get in the way of getting vaccinations, the longer this pandemic lasts, and the more our employees, residents, and their families remain at great risk. So we're here to address the shot questions with answers, mute the myths, and feature the facts, addressing the questions you've asked through our COVID mailbox. Featuring the Facts, Episode 1.
Hi, everyone. My name is Pete Smith. I'm the Chief Human Resources Officer at Enlivant with Dr. Jonathan Evans. Jonathan's a graduate of Mayo Clinic's Alex School of Medicine. He's board certified in internal, hospice, and palliative medicine. He's got a deep background in public health and epidemiology with 30 years of total experience. He's helped guide Enlivant through the entire pandemic. His combination of clinical and academic credentials, combined with his hands-on experience of dealing with this deadly virus, has been significant in guiding and advising us over the past months. I've selected some questions for Jonathan that have been frequently asked, as well as those that have been submitted by many of you to COVID@enlivant.com. That's COVID@enlivant.com. So let's start off with our first question. The COVID-19 vaccine was developed so quickly. I read on Twitter that the process was rushed or that corners may have been cut. Did they cut down on the testing process? Is it safe? Was the quick vaccine production effort just because of the 2020 national election?
Each of you has been given really a gift, a preferred slot to be near the front of the line to receive this vaccine. But I know some of you probably have never been first in line for anything good. And so naturally, given the speed of the vaccine development, as well as the circumstances of the last year, as well as probably your own personal experiences with healthcare and the like, that naturally you have questions, and many of you might be quite suspicious. Things did happen fast this year. This pandemic occurred. This virus spread all around the world in record time. Hundreds of thousands of people have died in this country, millions around the world. And something as extraordinary as that really required an extraordinary effort to try to get this under control. And so literally no money was spared. A huge number of people all around the world working together started immediately to develop vaccines for this specific virus. But the work had really started more than 10 years earlier to develop vaccines for viruses that are somewhat similar. I've looked at the data myself, and I'm completely satisfied that this process was extremely sound scientifically, that no corners were cut. And in addition to that, the review process by the federal government was the strictest in the world and actually took longer than in other countries.
Somebody asked that they'd read an article on Facebook that large numbers of people are getting seriously ill from the vaccine, that the risks of the vaccine aren't being reported. What are the risks or side effects from getting this vaccine?
The big concern that people have when they take a medicine or a vaccine generally is the possibility of something like an allergic reaction. And many of you are allergic to medicines like penicillin, for example, that affects 1 in 10 people in the world. There have been a very small number of cases where people had an allergic reaction to this vaccine. They were treated immediately, and none of them had serious or permanent injuries. Your odds of winning the lottery are probably greater than it is to get a serious allergic reaction from this vaccine. Now, it's very common for vaccines to cause some very minor symptoms like soreness in your arm or maybe feeling achy or tired. But those aren't side effects of the vaccine. Those are signs that your immune system is working.
I'm still unsure about getting the vaccine. I want to wait a couple of months to see if there are any side effects and if it really works. Can I get the vaccine at a later date when I feel more comfortable than at our clinic?
You do get a second chance to get this vaccine. The program that the federal government is paying for for us to get these vaccines involves a pharmacy coming to our community and setting up 3 different dates or 3 different clinics to be there to give each of us the vaccine. And on the first of 2 clinics, you have a chance to get the first shot. So if you're really, for any reason, if you really don't want to be getting the shot on the first clinic, you have an opportunity. It'll either be 3 weeks or 4 weeks later to have the first dose at the second clinic. The third clinic is simply to give people the second shot because this vaccine involves taking 2 doses to give you maximum protection. But this program is really only committed to providing those 3 dates. The third clinic is simply to give people the second shot. If you aren't able or don't want to get the vaccine during either of those first 2 clinics, then you're going to have to wait. If you get the vaccine in the future outside of one of our communities, you'll need to get it probably at a public health site or possibly at a CVS or a Walmart pharmacy many months down the road. We've been given this gift of being near the front of the line, and that's a reflection of the importance of the work that you do, as well as the vulnerability of the people that you care for, both in our communities as well as at home. What happens to you matters. It matters to me, and it matters to your entire family at Enliven. There's only one you. You're completely irreplaceable. And think about the people that you love, and think about the people that depend on you. Just think about how important it is that you be safe. That's my main concern here. Is I want you to be safe, I want you to be healthy, and I want you to look forward to a wonderful future where you can live your best life and help other people to do the same.
If you have questions about the vaccine, the virus, or anything in between, our COVID mailbox is always open. Send us an email at covid@enliven.com. Keep submitting your questions. We'll have answers in our next episode. Together, we can do it. And together, we can stay informed and stay safe.